Hello everyone, my name is Filippo Pietrantonio. I'm a GI medical oncologist at the National Cancer Institute of Milan.
Hi everyone, I'm Katell. I'm French, but I live in the Netherlands. I'm a colorectal cancer survivor and a patient advocate.
Colorectal cancer is a major health problem. The incidence of colorectal cancer is about 1.9 million cases worldwide. And the death number is really high, almost 1 million deaths each year. Everyone should be aware of the symptoms and signs of colorectal cancer. You may notice abdominal pain and also diarrhea or constipation and change in the bowel habits and also blood in your stools.
I didn't know anything about colorectal cancer. I thought it was an old person's disease. I had symptoms for over a year, belly pain, fatigue, changes in my digestion. And even with daily bleeding, healthcare professionals didn't take it seriously. I was diagnosed with stage 3 colorectal cancer at 40 years old. We all know that colorectal cancer is rising in young people. So my message will be know the signs and symptoms, don't wait, and advocate for your health. We don't want to hear you are too young anymore. If I would have been diagnosed earlier, my story would have been very different. I had chemotherapy, radiotherapy, and 7 surgeries. Today I live with the long-term effect of the treatments, including a stoma. Screening catches cancer before symptoms starts or at an early stage, where it's so much easier to treat. You don't have to go through so many treatments. So don't wait for a warning sign, get screened. A simple stool test at home or a colonoscopy can save your life.
Thanks, Katell, for highlighting your personal history. It's really important to raise awareness on early diagnosis and screening of this disease. So first of all, screening can save lives. And it's important to get screened. You may start the screening from the age of 50 up to the age of 74. But the start of screening age is decreasing in several countries, and now in the United States, 45 years is the age cutoff to start your screening. There are several assays and examinations used to get screened. First, fecal blood examination, which is used every 1 to 2 years to detect even small amounts of blood in the stools, and also colonoscopy. And all these examinations are useful for the early detection of colorectal cancer at an early stage with a more curable disease with surgery, with or without postoperative chemotherapy. It is also important to get screened for the diagnosis of polyps, which are benign and pre-malignant lesions that should be removed during a colonoscopy to avoid their transformation over several years into colorectal cancer. There are several risk factors for colorectal cancer linked to the diet. For example, it is known that the consumption of red meat and processed meat cooked at high temperature is a risk factor for colorectal cancer. And also the use of sugary beverages is a risk factor, and a diet rich in saturated fat. It is important to underline that a healthy diet can prevent colorectal cancer. In particular, the consumption of fruit and vegetables are important to reduce the risk of colorectal cancer. It is also important to reduce obesity, the levels of insulin, and also a healthy lifestyle can really help to prevent several diseases, including cancer, but not limited to cancer, such as cardiovascular diseases.
Thank you very much, Filippo. I fully agree with you. A healthy diet with more whole grains, fruit and vegetables, and less red and processed meat helps lower the risk of colorectal cancer and other diseases. There are very simple changes like swapping processed meat for plant-based meals, adding a few nuts a day, an extra fruit every day, and it can make a real difference. Prevention starts with what is on your plate, and also don't forget that alcohol is a risk factor for colorectal cancer, so watch out for your alcohol consumption. And smoking, of course, is another very high risk factor for colorectal cancer and other diseases.
Physical activity is of paramount importance for the prevention of colorectal cancer. People can have a sedentary life, however, in the meantime, when living most of our time laying down or sitting or reading and watching movies, of course, we can also have an healthy life and a physically active behavior. It is demonstrated that physical activity can reduce the burden and the incidence of colorectal cancer. And it is recommended by several guidelines that at least 150 to 300 minutes of moderate physical activity can really reduce the risk, significantly reduce the risk of colorectal cancer. We should also keep in mind that physical activity can prevent, as we said for nutrition, different diseases, not limited to colorectal cancer and other cancers, but also linked to the cardiovascular risk.
I've always been active during my treatment. I kept moving, even if it was not so much, walking a few kilometers, but it helped me recover faster. Now I'm back at the gym, cycling, hiking, and even ice skating. You don't need to be a marathon runner. Just 30 minutes a day of light exercise can reduce your risk of colorectal cancer. Start small, but start. I use a step app from Digestive Cancer Europe to keep track of my steps, and it makes it fun.
Yes, I wanted to thank Katell for being here with me today, and also all of you for listening. Please remember that colorectal cancer is a real challenge and a global health problem. We should raise awareness on this disease, and this is the perfect chance to keep in mind that every one of us should be screened and have a healthy life to prevent and to treat early this tumor type.
Thank you very much, Filippo, and thank you very much to everybody involved in that campaign. It's essential to raise awareness about colorectal cancer, and especially for younger patients. So my message for people listening today is take care of your health, and if you have any symptoms, please go to your GP. And if you want to know more, you can dive into the experience of the Wonderful Colon on the website thewonderfulcolon.com.